Two major causes of cardiac arrest are stroke and heart attack. We have already learned how to deal with consequences. However, as with all medical emergencies, recognizing the problems as they develop and seeking immediate professional help by dialing 999 or 112 will give the patient the best chance of survival. Coronary arteries supply the heart muscle with blood carrying oxygen. A heart attack is caused by a blocked coronary artery, thus depriving the heart muscle of essential oxygen. Signs may include chest pain, which can radiate into the arms, back or jaw, sweating, difficulty breathing, and feeling unwell or sick. CFR responders are permitted under FEC Clinical Practice Guidelines, CPGs, to administer 300 milligrams of aspirin to a patient with a suspected heart attack. The aspirin should be administered while awaiting the arrival of professional help. Aspirin is given to help prevent further blood clots from forming. Aspirin can be given to such patients provided they are over 16 years of age, do not suffer from stomach ulcers, bleeding disorder, and are not allergic to aspirin. Before giving aspirin, CFR practitioners must check intact packaging, tablets are in date, correct dose, that is 300 milligrams. Contraindications are checked.
Okay, Fred. Fred, you're telling me you have a pain in your chest?
Yes.
Okay. Is it very bad?
It is.
Very painful?
Yes.
Okay. And did you ever get this pain before, Fred?
No, never.
You've never had it before?
No.
And have you any medical problems? Do you go to your doctor for anything, Fred? No? And do you take any medication for anything? No. Okay. And nothing is easing this pain? It's just there?
Yes.
Okay. Fred, I'm going to give you a little aspirin. Have you ever taken aspirin before? You have taken this tablet before? Okay, and no problem. I'm going to give you one of these, and that might help that pain a little bit. Can you tell me, Fred, have you noticed recently when you've gone to the bathroom, have you been passing any blood in your bowels or that?
Nothing.
Nothing like that. And I don't have to ask you about your age, because I know you're over 16.
Yeah.
But you're a very young, good-looking man for your age. Okay. It's very frightening when you get a pain like that, isn't it?
Yeah.
Okay, Fred, so you might take this now.
A stroke is a medical emergency. It is caused by either a block or rupturing of a blood vessel which supplies oxygen to the brain. It can be fatal, so the earlier it is detected and professional help sought, the better the chance of survival. A simple test to identify stroke is known as the FAST assessment. F. Face. Ask the patient to smile and observe if the eyes or mouth droop on one side.
Hello, it's Fred, isn't it? Fred, you're not feeling too good. Fred, we're just going to carry out a few little tests. Is that okay with you? Fred, can you give me a big smile? Okay, good man, well done.
A. Arm. Once you have their consent, take their hands and assist them in raising their arms to shoulder height. Ask the patient to maintain their outstretched arms in that position. When you let go, look for one arm falling before the other.
And the next little test, Fred, I'm going to take both your arms in my hands and I'm going to outstretch them. When I let go of my hands, Fred, I want you to see if you can hold your hands in the air. Okay? Good man.
S. Speech. Check the patient's speech function by asking them to repeat a simple sentence.
Fred, can you tell me what day it is today?
T. Time. If they prove positive for any of the tests described, then it is time to call 112 or 999 for professional help.